Hello friends, welcome to Dr. Osman's Edu Trends, swing into educational trends. How are you all? Hope you are all doing well. Dear all, we are daily coming across new developments regarding prevention and control efforts taken by each country's government in response to COVID-19 outbreak, particularly regional lockdowns of over millions of people in each country, severe travel restrictions and forced quarantines, which are aimed at controlling the spread of infections and identifying those who are infected. We all are gearing up to fight today's evil virus that is corona. But thus, this much is enough? Can we alone stop its spread after doing self-quarantine? Is the role of public alone is enough, or the healthcare workers and the healthcare facilities are also important? Let's find out. Friends, we all are aware that during any natural disaster after Almighty God, if you are more dependent on anyone, those are no one but the healthcare workers. Healthcare workers and healthcare facilities are very important for rehabilitation or relief. These are the people who are working 24/7, 365 days to keep us safe without thinking about themselves. Yes, I'm concerned about the healthcare workers who are occupationally exposed to a variety of infectious diseases while performing of their duties during any natural disaster. Either it could be a drought, flood, earthquake, riots, terrorist attack, or disease outbreak like coronavirus. Healthcare workers may be anyone or the first responders, such as doctors, nurses, pharmacists, those found in variety of workplace settings, including hospitals, nursing care facilities, outpatient clinic, ambulatory care centers, and emergency response team, and last but not least, the local police personals. Friends, healthcare services being the most crucial service from the point of view of caring and rehabilitation of infected or the injured persons. Medical facilities of patient care requires the highest rate of preparedness around the clock, all 365 days. As hospitals and emergency staff are the first persons to manage the consequences of any disaster, assessment of their preparedness as well as the infrastructure facilities, most important thing in public interest. The World Disaster Report 2018 reports there were more than 3,700 natural hazards over the last 10 years. And there was an increase in 60% disaster events in the last decade. In addition to that, the number of reported deaths increases from 600,000 to 1.3 million globally. Preparing for disaster is very important and essential priority for everyone in every discipline for dealing with emergency situations. Preparedness is a coordinated effort that requires a multidisciplinary approach, cooperation and participation of all sectors. The overall capacity of a country to manage efficiently all types of emergencies, ensuring appropriate systems, procedures and resources is being calculated. It is also expected that governments looks to provide timely effective assistance to disaster victims to facilitate relief measures and rehabilitation of services. Friends, any disaster management includes 4 stages, which includes prevention, mitigation, preparedness, response and recovery. Healthcare worker has a significant role to play in terms of emergencies or disaster preparedness. Healthcare worker who has unique skills for handling all aspects of disasters expected to perform at the forefront. It includes assessment, priority settings, collaboration and addressing both preventive and acute care needs. Presently, when we all are facing a deadly coronavirus COVID-19, it has impacted healthcare workers' safety too. In February 2020, during COVID-19 outbreak, China reported more than 3,300 infected healthcare workers, many of whom died later. I can also remind you of a Chinese doctor named Li Wenliang, who died after getting infected, who also tried informing authorities of possible deadly coronavirus, but he was not taken seriously and an outbreak took many lives, causing growing concern among everyone worldwide. During an outbreak, healthcare workers are expected to work long hours under significant pressure with often inadequate resources while accepting the dangers inherent in close interactions with ill patients. Healthcare workers are vulnerable both to the disease itself and to the building pressure of increasing cases and their inability to respond them properly due to rumors and incorrect information, and that necessarily increases their anxiety levels. Healthcare workers are also expected to work efficiently and continuously and lots of pressure, as during any disaster situation which may goes out of hand, and miracles are expected only at the hands of healthcare workers. During this stressful situation, their anxiety levels gets raised which affects their health and they become reluctant to respond. There are multiple risks encountered by healthcare worker while performing duties during disaster, including less stringent safety regulations or infections control standard, limited availability of personal protective equipment, safety engineered devices or post-exposure management resources, unfamiliar practical conditions, equipments or procedures, challenging practical conditions that can prevent them from adhering to standard precautions, such as extremely resource limited settings or conflict zones, higher prevalence of transmissible infections such as HIV or hepatitis C virus or tuberculosis, with potentially increased transmission risk from untreated source patients. Healthcare workers regularly provide care in range of extreme circumstances, which may be characterized by limited or absent medical and public health infrastructure, lack of fundamental hygiene supplies such as soap and water for hand washing, no proper arrangements of washroom, increased infectious disease transmissions, extreme environmental conditions and high level of violence. Because of these increased risk and consequences of severe disease or injury, adequate prevention and preparations are essential. Health problems for healthcare workers can have serious implications both for the person and for those who depends on the healthcare worker for provision of healthcare. There should always be proper facilities provided to the healthcare workers. The role of healthcare worker plays a key role in handling emergencies. Disaster preparedness is also important and it helps in safe management of disaster practices in future. It decreases vulnerability and low mortality. So all of you, do like, share, comment and subscribe. Do not forget to press the bell icon to receive notifications on addition of new videos. Thank you.